the 11th IDSC 2025. Professor Wang Yao from Peking Union Medical College Hospital delivered a special report entitled New Advances in Epidemiology and Antifungal Resistance Surveillance of Invasive Fungal Infections in China. In 2024, Lancet Infectious Diseases published estimates of the global burden of fungal diseases, highlighting the incidence and mortality of life-threatening fungal infections. Overall data analysis showed that more than 6.55 million people are affected by fungal diseases worldwide each year, resulting in over 3.75 million deaths, of which 2.55 million deaths are directly attributable to fungal diseases. The latest global burden of pulmonary fungal infections, PFIs, was published in 2015. In 2021, there were 5.62 million incident cases of PFIs and 45,000 deaths, with a mortality rate of 0.56 per 100,000 population. Deaths from PFIs are projected to exceed 87,000 by 2044. In an era of global environmental change and a growing high-risk population, pathogenic fungi causing human infections are developing resistance to all approved antifungal agents. Global collaborative efforts are needed to steward available antifungal and guide the development of future clinical treatments and interventions. The resistance rate of Candida tropicalis to azoles continues to rise in China. A national multi-center study in China, CHIFNet, collected 3,702 isolates of Candida tropicalis from 87 hospitals and reported changes in antifungal susceptibility of Candida tropicalis. During 9 years of surveillance, fluconazole resistance increased from 5.7% to 31.8%, and voriconazole resistance from 5.7% to 29.1%. There were no significant statistical differences across geographic regions. Missense mutations in the target encoding gene ERG11 are associated with azole resistance in Candida tropicalis. Candida auris is a multi-drug resistant Candida species that has attracted worldwide attention in recent years. Cases of Candida auris infection have been reported in many countries. Common risk factors for hospital-associated Candida auris infection include insertion of catheters and other medical devices, history of antibiotic therapy, prolonged stay in intensive care units, history of surgery and other underlying medical conditions. In a nosocomial outbreak in Pakistan, 97% of patients with Candida auris had indwelling vascular catheters, which were considered the main source of 89% of candidemia cases. The introduction of azole antifungals has improved survival in patients with invasive aspergillosis, IA. However, the number of azole-resistant Aspergillus fumigatus isolates has increased markedly over the past decade. Azole-resistant Aspergillus fumigatus can now be recovered from both clinical and environmental sources. Mutations at the CYP51A locus of Aspergillus fumigatus in patients during long-term azole therapy can lead to fatal IA, indicating that prolonged azole treatment may induce azole resistance. In addition, increased use of azole fungicides also contributes to the emergence of related resistance. Invasive fungal diseases are confronted with three major challenges: worsening drug resistance, widespread azole resistance, emerging echinocandin resistance, and the occurrence of multi-drug resistant/extensively drug-resistant strains. Threats from new pathogens, including the rapid increase of the superfungus Candida auris and related species, and the rapid expansion of the super-resistant clone, Candida tropicalis clade 4 lineage, severe insufficiency in diagnostic capacity. These challenges lead to difficulties in diagnosis and treatment and high mortality. Candida albicans remains the leading pathogen in fungal bloodstream infections, with an increasing proportion of non-albicans Candida species. In HIV-infected individuals, infections are mainly caused by Saccharomyces, Marneffate, and Cryptococcus neoformans. Fungal central nervous system infections are predominantly caused by Cryptococcus, with generally good antifungal susceptibility. Pulmonary aspergillosis is still dominated by Aspergillus fumigatus, which shows high susceptibility to azoles and amphotericin B. Overall, there's an urgent need to strengthen antifungal resistance surveillance, data accumulation, and the construction of diagnostic systems. This concludes today's interpretation. Please continue to follow up Dynamiker on related platforms for more exciting content.